When it comes to the COVID outbreak, the latest numbers are very telling. Among Florida's major metropolitan counties, Duval County now stands with the worst in several key metrics, including positivity rate, vaccination percentage, and infections per 100,000 residents. Yesterday, this area's medical leaders joined the mayor with a unified message. If you are not vaccinated, get the shot. It is safe. Joining me on the morning show is Dr. Sunil Joshi, president of the Duval County Medical Society Foundation. You were with the mayor. Good morning.
Good morning, Bruce.
Appreciate you being here this morning.
Absolutely.
So the message from all is, it is safe to vaccine. Well and good. Is just telling people enough, or does there need to be more of a concerted effort to get to change people's minds, an action plan, if you will, because there wasn't one presented yesterday?
Yeah, I mean, I do think having an action plan, having a concerted effort can make a difference, but we also have to keep in mind that local government, city government can only do so much. Sometimes this is up to us as well, up to us as medical leaders, as community as a whole, to come together and collaborate on a way to educate people about the safety and effectiveness of this vaccine. And I think what we really need to do is have a collaboration of different healthcare providers, community leaders, to have a media blitz of some sort, involve News4Jack, some of the other television stations, radio stations, social media outlets, to get the word out about the safety and effectiveness of the vaccine, dispel some of the myths and rumors, much like we did last year with the Flu Vax Jacks campaign. I mean, it did help us increase understanding of the flu vaccine and increase vaccination rates. And we should be able to do something like that if we can come together.
Look, you and I have talked about this before. There is a lot of misinformation out there.
Right.
There are a lot of lies out there that are perpetrated again and again and again. Is there somebody who can be a human truth index?
Well, yes. And so I think this is part of the problem we've had since the very beginning of this pandemic, is that people trust their physicians, their healthcare providers, people who they go to see when they are sick. And throughout the process, it's kind of been taken out of the healthcare providers' hands, even from the beginning of the pandemic, even now with vaccinations. You know, people initially, of course, it made a lot of sense for people to go to Regency Mall and the Gateway Shopping Center to get their vaccines, because the demand for the vaccine was very, very high and the supply was low, and we wanted to vaccinate as many people as quickly as possible. Now we've gotten to the point where the people who wanted the vaccine have gotten it. The people who are never going to get it are never going to get it. And we've got those folks in the middle that are sitting on the fence. They are typically not going to get up from their chair and go to CVS or Publix just to get the vaccine. But if they come to see their doctor and they're speaking with their physician about it, and they get their myths dispelled and they understand the importance of the vaccine and they want to get it, they're much more likely to get it if the doctor has a vaccine right then and there. And believe it or not, the vast majority of us don't have the vaccine in our offices yet.
You know, I think about Florida's anti-smoking campaign. Yeah. There were real stories about real people. There was one lady, her name was Terry, and we saw her life deteriorate before our very own eyes. If we have real people telling their stories, might that be effective? I
think it would be very effective. And so that's part of this, campaign to try to educate people, is maybe you have family members of folks who have suffered with the virus, people who've had to be hospitalized, and to let them tell the story. I think people can trust their own colleagues who may have been sick as well. And so having the story out there, what really happens in the hospitals, I think would be important for people to understand.
Dr. Haley talked about this yesterday, made this point. Demographically, the tide has turned. Younger people are getting sick. Also, if you look at the ethnic profile right now, you find that that has changed. And it points to the fact that there is politics that is coming into play. How do you tell people, forget about the politics, turn to the science?
Okay, so I think the way you do that is getting the politicians out of it. Okay, so I think we needed political leaders at the beginning to help us set things up. We need to get the science, the scientists, the physicians, the healthcare providers out in front of this. How many times do you turn on a television program, a news program, a national news program, and you see an actual physician talking about this? It's typically the politicians that are talking about it. People don't trust their politician, let's be honest. And so we need to get physicians out in front of this. And I think it's also important to note that public health here in the state of Florida, funding for public health in Florida has been cut dramatically over the last 10 years, and that's also been part of the problem. That's why we're not getting the messaging out through public health officials, because we just don't have as many of them as we should.
All right. Now, there are some efforts underway. My friend Dr. John Newman has an effort that begins this afternoon. He will host a virtual town hall encouraging people to get the jab for city council members, the mayors of Atlantic and Neptune Beach, and a number of doctors are expected to be there as well. The event starts at 5:30, and you can watch it live on news4jax.com. Dr. Joshi, always a pleasure to have you here, and I thank you for your time.
Thank you.